Hi, I'm Dr. Jeff Rhode. I'd like to introduce you to a new product that is solving two of dentistry's most important and difficult issues: improving the diagnostic quality of an X-ray and reducing X-ray exposure to your patients and to your staff. By using the Tru-Align positioning system with your existing round collimator, and whether you're using phosphor plate, digital X-rays, or traditional film, you'll produce sharper images with better diagnostic quality. You'll also be reducing the X-ray exposure to your patients by up to 70%. Here's what two leading dental radiologists had to say about Tru-Align.
According to Dr. Dale Miles, Tru-Align reduces X-ray dose by 60%, even with digital sensors. So regardless of receptor speed, there is a substantial percentage dose savings with Tru-Align, in keeping with the ALARA principle, to keep X-ray dose as low as reasonably achievable. According to Dr. Alan G. Farman, the use of a rectangular collimator is fully endorsed by the American Academy of Oral and Maxillofacial Radiology, and also by the latest guidelines on dental radiography from the National Council on Radiation Protection. Solid-state receptors stop the radiation almost completely from affecting the deeper tissues, so it is likely that rectangular collimation will result in an even more efficient reduction in dose with solid-state detectors. Consequently, rectangular collimation is at least as important with solid-state detectors as with radiographic film.
These are powerful claims from leading experts. But perhaps the most important contribution by Tru-Align to reducing radiation exposure is its ability to eliminate retakes. According to a leading journal, 25 to 40% of all intraoral X-ray images are retakes. But when I first heard that statistic, I thought, there's no way we have that many retakes in our office. And then I checked with my hygienist, who actually takes all of our X-rays, and it wasn't as high as stated, but it was a lot higher than I thought. With ordinary film cameras, we are very careful with every shot. Then digital cameras came along and we knew we could take 10 shots to get that one perfect one. What I learned is that with digital X-rays, that same thing happens. Due to ease of acquisition and difficulty in placing that sensor, we tend to take more retakes. When the ring is perfectly aligned with a collimator using a precise LED laser, the Tru-Align will emit a beep and a light will flash, signaling to the operator that it's safe to take an X-ray. If used properly, Tru-Align will effectively eliminate retakes. Tru-Align easily attaches to the traditional round collimator on your X-ray head in seconds. There's no need for a technician. This is something you can do by yourself. If you're among the 70% of offices that use a positioner like a Rhode or a Flow, there's no modification to your existing technique. In some offices that use digital sensors, the operator places the sensor and the patient holds it with a finger. It eliminates using a holder, but the cone is aligned by sight with the sensor. It appears to be efficient, but is it really? A shotgun requires no sight or scope, so only a small portion of the shot actually hits the target. With the finger method, less than half the photons actually hit the receptor. The rest are scattered into tissue and onto the receptor as fog or noise. A rifle instead uses a scope. With X-rays, the Tru-Align is the scope, helping to aim the photons. There's almost no scatter effect or noise. Tru-Align is actually a laser scope that beeps and flashes when the target receptor is in perfect alignment. Tru-Align improves the diagnostic clarity of the image dramatically. Take a look at the startling difference between these images from the Department of Radiology at Stony Brook University Hospital in New York. Same machine and operator, but it's clear that Tru-Align will greatly improve the diagnostic quality of the images from your machine. If you've been paying attention to the news for the past few years, you are aware of the ever-increasing media reports about the dangers of radiation. From the New York Times to Dr. Oz and countless other outlets, your patients are being informed and alarmed about the many sources of radiation in their lives. From airport scanners to dental X-rays, the news is just not positive. With Tru-Align, you can point to the green ring as a symbol of your commitment to improving radiation hygiene in your office. The Tru-Align positioning system is establishing a new standard of care in dentistry, making it easier than ever before to produce high-quality diagnostic X-ray images. It's efficient, it's cost-effective, increases productivity, improves safety, and it's absolutely accurate.